So viewers, today we are here with the trending topic allergy. WHO, World Allergy Organization, celebrating 2022 June 5th to June 11 as the World Allergy Week. And to throw a light on this allergy, we have with us today Dr. Vivek Veerapaneni. He is an allergist and a senior pulmonologist from SWASA Hospital, Narayanaguda, Hyderabad. So let us start the discussion with Dr. Vivek Veerapaneni. Sir, hello, welcome to the program.
Hello, Shuja. Good afternoon.
Good afternoon.
So this is our second interview.
Yeah.
So regarding allergy, so this June 5th to 11th is World Allergy Week, so by World Allergy Organization.
Okay.
So it's been celebrated every year, but this year we are doing an interview regarding this.
Yes.
Just to create more awareness among public regarding the allergies.
So, sir, generally what I would start with here, that generally what we have seen in public, in a normal life, what we have seen, whenever there is a skin rashes or such thing like that, the people consider it as an allergy. But specifically, we want to understand what actually allergy is. So what is allergy?
Allergy is nothing but a tendency to overreact to things that you're not supposed to react to.
Okay.
Right? If you are a person without allergy, you would not react to certain thing. But an allergy patient does react to it because of underlying tendency called as atopy. Atopy is a nature where they react too much to few things. Like it can be an allergen, which has a protein like a dust mite or a pollen grain that comes out from flowers, or some insects, or it can be something like an irritant, which can be pollution or some smell or smoke of agarbatti or a perfume or a cigarette. So a patient can react to any of these. So this excessive, unnecessary reaction of the body to those items is called as allergy. So the tendency to develop this is called as atopy. So one more question you asked is allergy. Usually you heard about skin allergies.
Yes, usually.
But people think skin allergy is only the allergy there.
Yes, that's what.
Or some people think only nose allergy is the allergy.
Yeah.
Anything else is not.
No.
But that is because of probably lack of awareness. There are many types of allergies and many areas where it can affect. Suppose if the allergy is affecting your skin, obviously everybody knows it.
Yes.
It's called eczema or atopic dermatitis. It can happen from the age of 1 till the end, so anytime. But it is fairly common in early ages, atopic dermatitis. So if a child is having atopic dermatitis, that means the risk of him developing allergic rhinitis, that is allergy of the nose, or asthma, that is nothing but allergy of lungs, is almost 80%. It's very high. So if your kid is having any kind of allergy, especially in this area, in these flexures of the arms, forearms, and in this area, that means he has something called as eczema. He may later on develop something called as atopic, other atopies such as allergic rhinitis and asthma. So suppose the allergy is in the nose, it's called allergic rhinitis, where a person can have running nose, sneezing, nose blocks, or itching of nose, even itching of ears and eyes can be there in allergic rhinitis. So this problem is usually seen slightly in a age group of around 7 to 11, or it can be seen in teenagers, adults, even elderly people also sometimes, rarely.
Any gender specification more in females or males?
Allergies as such are more common in boys, while boys as in less than 10-year-olds or 12 years. Once the age shifts, once they become teenagers or adults or adolescents or elderly, it is more common in females. There's slight female preponderance, especially in asthma. Asthma is more common in females, elderly or adult females, and more common in young boys. So this is how it is, diversified. And one more question.
Is there any role of environment in this, in triggering allergies?
Yes. Before that, I would like to tell that it is a genetic tendency. So if you have allergies, your kid may or may not have it, but there is a good chance that he may get it through your genes.
Probability is there.
Probability is there because it is mediated through genes. All these allergies, especially asthma, is heterogeneous. We call it heterogeneous because multiple genes are involved in development of this disease. Similarly, other diseases, other allergies also can have gene involvement, which is usually there. And there are two more things. One is environment, which is a very good question. Yes, environment does play a role in development of allergies, especially a person who is already having a genetic tendency to develop allergies. If he is exposed to any dust mites, that is, the mites that are there in our bed sheets and mattresses, or exposed to any pollen grains, or for that matter, any other allergens, he can develop allergy. So that genetic background is stimulated by this environmental allergen.
Okay.
So epigenetics is what we call, where environmental trigger is going to go and cause this reaction when in a genetically susceptible person. So this can happen. So an environment plays a big role. So not just all these allergens, but also pollution plays a very big role in allergy, and also self-pollution by using these perfumes and even smoking. All these are irritants, which can eventually lead to any kind of allergy anywhere in the body, or some other diseases like asthma, COPD.
Okay.
So apart from this, allergy can be seen in patients who are overly hygienic, extremely hygienic.
Achha.
Right? There's something called as hygiene hypothesis, which is studied world over, and a lot of studies are there where they've compared children who are following excessive hygiene, suppose urban population who live in cities, apartments, versus children who are in villages, who live with other, there's a farm beside the house, where there are horses or there are cows where they feed. So when they have that kind of environment, the level of endotoxins that are very good in development of Th1 type of immunity, which is a good immunity, are high in them. Whereas in children who are in these apartments or this completely neat houses,
hygienic conditions,
all kinds of lotions to clean the floors, walls.
OCD kind of disease, somebody has a OCD kind of disorder, something like that.
Everything. So excessive, being extremely hygienic, over hygiene is actually bad. It may decrease viral infections. That's what they think. Bacterial infections or COVID, especially these 2-3 years, people are thinking that being extra hygienic. Even now, there's a lot of people who use over sanitizers, including sanitizing their homes, which is absolutely baseless. So they should kind of stop it, because the more sanitizer, the more chemical you put on your body, that is going to kill the all natural microbes that are there, in your palm or in your this flexure, because there are thousands or lakhs of types of different bacteria that are there in just this area. Or this area. So, and they are different from the bacteria that are there on this hand. So there's that amount of diversity, and all of that is required for us. We need all the good bacteria. Our body is predominantly made up of them. Apart from the organs, a lot of bacteria, we have trillions of them. So you're killing all those good bacteria, that in turn causes more allergy. So that's probably leading to this more and more allergies in these urban children. So studies comparing both urban and rural, there is a big difference in the number of allergies. Urban children have a lot of allergies compared to rural, where they hardly have any kind of allergy. Even with the patients we see are mostly from urban areas, who are living in cities, apartments, on all, but we hardly see people who are coming from villages having allergic rhinitis or asthma. They tend to have different types of infectious diseases rather. So these are the three important things: genes, environment, and this hygiene. Are three important things that can play with this disease.
So my takeaway with this point is, I remember the daag achhe hote hain. So remember, daag achhe hote hain. Then going into the environment part, sir, I would just like to understand that, as you said, environment is triggering this. So we are almost into the June month, sir, and very probably the rain is going to start in after a couple of days, hopefully. So I just want to understand, is there any difference between the common cold, the sinus, and the allergies?
Extremely good question. I think a lot of people need clarity on this.
Yes, sir.
So you asked common cold, sinus, and allergies. I will add one more thing, that is flu.
Okay.
Right. Fine. So allergies is that person is specifically reacting to a allergen. It can be a dust mite or a pollen grain or pollution, whatever it is. Here there is no infection involved. There is no infection.
Okay.
It's just pure allergy. It will not spread to you. It will not spread to him. No one.
Okay.
It is just there in you. You probably have that gene, so you're having that allergy.
Okay.
Whereas a person who has common cold is different. Common cold is because of this rhinoviruses or adenoviruses and some coronaviruses as well.
Okay.
So it can cause common cold. So these common colds usually last for 5 to 7 days, and they usually, they're usually self-limiting. They're not so harmful.
Yes.
Unless you have underlying other conditions. They're usually relatively safe. They tend to present with some fever or runny nose, which usually subsides in few days. And one more thing is flu. The third one is flu, where it is caused by influenza virus.
Okay.
Example is swine flu.
Okay.
Right? Spanish flu. All these are flus which can be dangerous. We have seen swine flu pandemic in 2009-10, and later on also we kept having cases every year. Even now we get swine flu cases.
Okay.
And there was Spanish flu in the last century, which caused devastation just like COVID did in our century. So there are different types of flus. All these are influenza viruses. There's a cycle between these seabirds and swines, that is pigs, and also humans. This kind of circulates and mutates every year. So that is the reason we give flu vaccine every year to few patients who are susceptible to infections.
Okay.
So that is the third type of cold. So not all colds are allergies. Yes. Not all colds are flu.
Yes.
Not everything is a common cold. Everything is different and separate with different etiologies. And third and fourth one you asked was sinus. Sinus is actually something everybody has. We have sinuses, but people commonly call it sinus. Yes. Whereas scientifically it is sinusitis.
Okay.
Where we have sinuses that are normally filled with air cavities, but in sinusitis they are filled with water. Not exactly water, for you to understand. Maybe it is
mucus type of something.
Or phlegm, or fine. Sometimes it can be fungus as well. Right? We have seen black fungus cases also. That can be sinusitis as well. But usually in allergy patients, it's quite common. And it can be allergic fungal sinusitis as well.
Okay.
So there are different types in bacterial sinusitis. So sinus is a different area again.
Okay.
All right. So if you have running nose, probably these three are the common causes. Rarely there's something called a CSF leak. Not related to this topic.
Okay. Yeah. So is there a specific reason or specific season for a allergy to get triggered?
Nice rhyming. So specific reason
and particular season.
Achha. So reason I told you, right? There are background is genetic. There's a genetic background.
Okay.
Upon that a person is and there's an environmental influence. So that is causing some kind of itching or sneezing or running nose or nose blocks to him. And that is allergy in the nose. The same allergy, if it is in the eyes, it will cause eye itching. It's called conjunctivitis. Same allergy in the ear, it's otitis. There's a tube between nose and ear. It's called eustachian tube, which usually children have these nose blocks. And for them, there's block of this eustachian tube as well. That leads to formation of fluid in the ear, which may later turn into pus. That's called as otitis media. So the background of this problem, if you look into or dig deep history, it takes you to allergy again. So allergy in throat, it's called pharyngitis, or you can call it upper airway cough syndrome. The same allergy in the skin is eczema or atopic dermatitis. Same allergy in the lungs is asthma. So different areas, different names.
Yes.
Right? So basically, there should be an environmental trigger and genetic background. Sometimes genetic background is not required, it can be sporadic, it can start in you. So just environment, or it can be occupational. So you're in a particular occupation, you're exposed to some particular chemical, then you develop some allergies or asthma. So these are the different types of reasons. Whereas season, you asked.
Yes.
So usually allergies are more common in winters and rainy seasons.
Okay.
And some people experience it while there's a shift of the season. Right? So like spring and
the transit phase of these seasons.
Transition phase is where they experience symptoms.
Okay.
And other that is usually in the month of February is where there are a lot of pollen grains in the air.
Okay.
And also in the month of October, they're very high. So these 2 months, especially patients who are living in the US rather than India have a lot of symptoms because pollen is too much over there.
Okay.
Even here it is there. So February and October are the months where allergies tend to be very high for the pollens.
Okay.
Whereas if it is for a dust mite, it can be 24/7, 365 days. There is no particular day, time, usually more in the mornings and nights. But if it is dust mite, if it is cockroach, they are all indoor allergens, they are inside the house. So you tend to have the allergy all through the year. So when you come to rainy season, so especially after rain, immediately after rain, the density of this pollen grains in the air increases significantly. So the number of pollen grains significantly increases following the rain.
Okay.
So that's why post rain or in rainy season, many people develop allergies. That is probably secondary to a pollen grain. And also there is a lot of wet, water everywhere, things get wet. So that is where the fungus grows,
okay,
if it is happening constantly. Okay. So a fungus can release spores. That spores can cause allergy. So in rainy season, we see a lot of new allergy cases, especially sensitized by pollen or an allergen like a mold, that is fungus. Okay. So these are the reason and season answer for you.
Okay. Thank you very much, sir. Also, I would like to know on behalf of my viewers who are more of a non-medical background. So I just want to know that is allergy a disease which is under communicable disease? Does it spread person to person?
Yes.
Because what happens in allergy, sir, if I got an allergy, I may sneeze. So if I sneeze or if I have some kind of running nose kind of problem due to allergy, I may consider it as it may spread to some other person in the family. So I just want to know, is it a communicable disease?
Allergy is not communicable disease. It is non-communicable.
Okay.
Yes. So of course, this interview is specifically directed to a general public only,
yes,
for laymen,
yes,
because doctors already know many
absolutely
things. So I want you to know that allergy is a non-communicable disease. It will not communicate. It will not transfer from you to your colleague or your wife. It won't. But however, differentiating allergy or common cold or flu is extremely difficult, because even in common cold you can have sneezing.
Symptoms are almost same.
Almost same.
Almost same.
But itching is usually specific for allergies.
Okay.
Right. So itching of nose or eyes, usually specific for allergies. If you have sneezing, it can still be common cold, but you can have fever if a virus is involved. Okay. So there is a combination of fever plus sneezing and other things. Maybe it's a common cold.
Common cold.
Again, there's a catch. There's something called as hay fever.
Okay.
Where it is an allergy, where you develop high-grade fever.
Okay.
So you really can't distinguish it by yourself at home. So it's better to consult a doctor to distinguish between what is the type of cold you're having. But if it is allergy that you have already, it will not transmit to others. Through air like COVID, it won't. It is not communicable.
So sir, when it is very difficult to understand the difference between a common cold or allergy, is there any certain system like screening of any investigations, any screenings which actually lands you into the diagnosis of the particular allergy or a common cold? Is there any screening like such thing like that?
There are screening tests for allergies.
Okay.
But it will not give us a final diagnosis.
Okay.
Unfortunately. There is no single test where you do this, yes, you have allergy. We can't say that.
Okay.
Right? So, but see, allergy is something that history is the only answer here, not test.
Okay, patient's history.
Yes. If patient has similar complaints in the past, since a long time, maybe a few months, few years, a few weeks, we don't know. That is allergy. If it is probably once in a year, maybe it is common cold or flu, we don't know.
Absolutely.
So it depends on history, mostly history.
Okay.
We have to delve deep into the history. And one more thing is, yes, tests will help us. They will guide. We will talk about it.
So sir, if there is a case of a false positive, like a report is normal, but the patient still shows the symptoms of allergy. So how do you consider these kind of situations?
False negative.
False negative.
So thing is, suppose we do an IgE test. So allergy tests are something like total IgE levels.
Okay.
Or even specific IgE levels.
Okay.
Or skin prick test. All these are the tests that we have for diagnosis of allergies. And of course, we have something called as RAST or immunocap, which are a higher level test, specific IgEs. But we usually don't do it for all patients because they are expensive. So we usually start with specific IgE, eosinophil counts, and skin prick tests. So these tests kind of guide us. If they're positive, doesn't mean definitely the patient has allergies. There should be some clinical correlation.
Yes.
Clinically, there should be some history of any symptom once they are exposed to that particular allergen. And even if everything is negative, a person can severely have all the symptoms and can have allergies.
Okay.
All right. So allergy test does not necessarily give you answer every single time. So that is what you should understand. So false negatives are common. So you should not blindly go by tests.
Okay.
So that's where a role of allergist comes, where you need to properly diagnose the case, not just with tests but also with history and other clues.
Okay.
And also there are some signs where a patient has nose allergies, that is allergic rhinitis. They will have a line here. So it can be there in some patients, not in all. So we call it allergic crease.
Okay.
There are some signs that we see in the face, not just here but also in every other area. So we can make out by looking at that.
Okay, sir. Is there a role or a connection between allergy and asthma?
Extremely good question. So allergy, yes, asthma can be allergic asthma or non-allergic asthma. So allergic asthma, when it is triggered by a particular allergen, or there was any history of atopic dermatitis or allergic rhinitis in the past. But if the patient doesn't have any history of allergies, if it is a new patient who does not have any history of allergies, it can be a non-allergic asthma as well. It can be irritant asthma. It can be occupational asthma. So it can be some asthma that can be related to consumption of something like aspirin. It is aspirin-sensitive asthma.
Okay.
Or it can be exercise-induced asthma, right? So there are many different types. So it all boils down to the doctor who is talking to the patient, who takes good history and write a particular test who can diagnose the patient.
Absolutely. Sir, my last question to you for the day: can allergies be cured?
Everybody's hope, even mine, in the near future. But as of now, yes, we can control them very well. There's something called as allergic march or atopic march, right? Where as a child you would have skin allergies like eczema. Slowly, as age progresses, 1-2 years, you'll have food allergies. Slowly, at the age of 6, 7, 8, you'll have allergic rhinitis. Slowly, probably at the age of 9, 10, you'll have asthma. Or it can be, the sequence can be reversed in the case of allergy and asthma, the rhinitis and asthma. So by the age of teenage, you'll have again severe allergic rhinitis. So it keeps dancing, this allergy, between different places. So eyes, nose, ears, and skin and lungs. So yes, allergy is usually the birthplace for asthma in most of the cases. So people think allergy is completely different subject and asthma is different subject. It's not. Most of it is linked. However, yes, there are eosinophilic asthmas. I told you, right? Exercise-induced asthma.
Yes.
Different types of asthmas, yes. But allergic asthma is quite common, especially in our population. And other allergies, yes, slowly as the person ages, probably by 20, 30, he'll be only left out with one disease, that is probably asthma or allergic rhinitis. Others will slowly go away. They will outgrow the disease. It's not that all the allergies will stay with him forever, right? The allergies I told about. So probably only asthma will be the only one. And even in asthma, some patients will automatically outgrow it, some children. And it may come back in future if they are exposed to some triggers. So allergic asthma is common, and it can be triggered by all these dust mites and all that. So that is hard to cure completely, but yes, we can control it extremely well. And asthma control is quite poor in our Indian scenario. Our patients think their asthma is under control, but unfortunately it is not. Almost more than 90% of the patients. So you need to keep your asthma under control to prevent it from progressing from mild asthma to severe asthma. And you need to be on particular medicine. You don't have to use 10 medicines. So maybe during exacerbation you need to use more medicines, but later on, once you're fine, once you're doing well every single day, you feel like you're absolutely normal, then probably you'll need one puff a day.
So the entire course will have some down titration of medications.
Yes.
As
Depends
per the
on
symptoms,
symptoms and severity of the disease.
Okay.
So if they're on good treatment, they're adhering well to the medication given by the doctor, they're religiously using the medicines, then they will actually have a better quality of life, and they will actually spend less on medication, and also spend there'll be less usage of steroid, and they eventually be more healthier as well than patients who are using on and off, which is not good. So yeah, and if you talk about triggers or foods, some people commonly ask these questions.
Yeah.
So some foods that are more sour or cold items, which have preservative that can trigger some kind of irritant reaction, or even some fruits, apart from all the previous allergens that we have discussed, can cause exacerbation of this underlying disease or asthma or allergies. So yes. So
thank you, Dr. Vivek, for knowledge sharing. Thank you very much.
Sure, thank you.
So today So today we had with us Dr. Vivek Veerapaneni. He is a senior consultant pulmonologist and allergist at SWASA Hospital. So today throw this light on allergy and its disorders. Next we will be back with Dr. Vivek again with a newer topic. Thank you.
Thank you. And on the occasion of this World Allergy Week from 5th to 11th, this is just a awareness initiative taken by us to for your more information about allergies, because there's a significant lack in knowledge
Absolutely
in this particular allergy topic in the crowd, and there are a lot of misconceptions as well. So I hope you take back something from this, and just remember that there's something called as allergy, and it is different from flu, it is different from common
colds,
and anybody can have it. Any child or adult can have it, and it is quite common disease. Probably more than 25 to 30 crore people in India will have one or the other different kind of allergies, and it is quite common. There's nothing to be ashamed of whether if you have asthma or allergies. So that is one important point, because it is a quite taboo disease that I have allergies. It's a small thing, but people try to hide it, especially asthma. So be open, take treatment, you'll have a wonderful life. Thank you.
Thank you.